This video is solely for the purpose of providing information to users of Paradigm Medical Systems training models and the correct use and care of those products. They do not intend to show correct clinical techniques and must not be used in any way as a clinical training guide.
Welcome to our orientation video for new owners of our GYN trainer. Please keep in mind, I am not a clinician, and so if I do anything that wouldn't be done with a real person, excuse that. And while I have participated in many workshops, I do not have a clinical background. So this is just me teaching you how to use the model and encouraging you to be creative, because if you think it might be able to do it, it probably can. This model comes with 7 different uteri. It also has a urethral opening that does not have a bladder for return, but can be used as a landmark and can be used for catheterization, and it does have a rectal opening as well. So the 7 different uteri, fibroids, large, small, medium, retroverted. We have one with a cyst, and we also have one that is hollow. A lot of people use it for IUD training or swabbing. These can all be moulaged, so any type of pus or fake blood or things that you would want to accessorize with, you can. The back is simply a slot, so the different uteri swap in and out real easily. You just get a little bit of lube, pick the one you want to use. Fibroids happens to be my favorite. Lube it up a little bit, insert, oops, I'm used to doing this when it's in front of me, and place it into the correct position, which can be done. There we go. So then I push it down a bit so that it's where it should be. So now that I have in the uteri, I can get a speculum. A plastic speculum can be used. We have a metal speculum. And do keep in mind, as I'm inserting this, I am not a clinician. I have never inserted a speculum into a human, just a model. So, a lot of customers use this in a hybrid situation with a standardized patient, and so most of the interaction is between the student and that standardized patient until the exam, and then we lift up the drape and this is what they're coming to. Or they just use it without a standardized patient, but kind of acting a little bit while using it. So saying, you know, you're going to feel my hand on your thigh. I'm going to be inserting the speculum now. I've lubricated the speculum. If the lubricant starts to dry a little bit, I'm just going to add a little bit of water. Okay, now I don't know how to insert, so I'm going to just do my best. See the cervix. If you were going to be inserting your fingers, you would put lube and then feeling for and then should you need to do the rectal portion of the exam, again, I would need to be lubricating. Exam. Any questions?